traffic fatality this year, and that investigation is still ongoing. We're midway through National Non-Smoking Week, and that makes this Weedless Wednesday. Lisa Hafner joins us live with more on what the province is doing. And those numbers still really scare me. You said 1 in 5 in Ontario is a smoker, Lisa?
Isn't that amazing, Taz?
Yeah.
About 19% of Ontarians are still smoking. And in Hamilton, it's about 2% higher than the average. I've got Jennifer Mitton from Hamilton Public Health here with me now. What do you think is the problem in Hamilton, that there's more smokers here than in other parts of the province?
Well, we know that smoking is linked to poverty rates, and we do have a national or a higher than provincial poverty rate in Hamilton. So it would make sense that for some segments of the city there would be a higher smoking rate.
And it's really dramatic. I was astounded at your numbers that there could be a 21-year gap in the life expectancy from one neighborhood to the next, and you believe that's due to smoking?
It would be a partial contributor, and that data comes from the University at McMaster.
Everybody knows that smoking is bad for their health, right? So why is it so hard for people to quit?
Well, we used to think of smoking as a bad habit, but we know that it is a physical and psychological addiction that needs proper medical treatment.
And I believe the Canadian Medical Forum is starting to let people know more about what resources are available to them if they want some help quitting.
Right, so the Hamilton Academy of Medicine has taken a very good first step in terms of launching a campaign for people in the community to speak to their doctors about effective treatments for smoking cessation.
Is that where the need is, do you think? Is that people need to know where to go to get help?
There needs to be the help available, and people need to be confident that that help is going to be beneficial. And we do know that health professionals can provide effective treatments.
To provide effective treatment. So what sort of treatments are there? What do people have available to them?
Right, so the effective treatments are behavioral counseling along with medications. Nicotine replacement therapy, Champix and Zyban are the effective medications.
Now, we also just heard today that the province is planning to offer nicotine replacement gum and nicotine patches for free to the public starting in the spring, I believe. Do you think that's worthwhile? Is it worth the investment of time?
It's a great first step for the provincial government to make those medications available, because we do know that smoking and poverty are linked, and unfortunately the medications, when they're not covered, are not accessible to the people who need them. So it's a great first step. And it's also great that they've linked it with family health teams so that people have access not only to the medication but the counseling support as well.
Yeah, you were saying in the release that you need both. You need the counseling and you need the medication, right? It's amazing how expensive those nicotine replacement therapies are for people.
And that does make it unaffordable for people, especially when there's access to cheaper cigarettes, and we know that is the problem in the community.
Do we know why poverty and smoking go hand in hand?
There's a lot of studies looking at lifestyle or behavioral issues and issues of addiction and poverty. I don't think there's any conclusive evidence as to why.
So Weedless Wednesday, do you have any final advice for people today?
The Driven to Quit campaign is launched from the Canadian Cancer Society. If you are thinking of quitting smoking, log on to driventoquit.ca and enter for your chance to win a car.
A car or a vacation or gift cards? I was checking that out too. It sounds like an excellent time to quit if it's still part of your routine. Taz, back to you for now.
Okay, let's hope it gets people the incentive to butt out. Thank you, Lisa. Premier Dalton McGuinty is giving up his battle to